Hi, Kate. My name is Megan. I'm a student physical therapist. Is it alright if I work with you today?
Yeah.
Alright, could you go ahead and take your shirt off for me? Alright, I'm just going to stand behind you and kind of observe. I'm looking at all the lumbopelvic landmarks, so iliac crest. Here, go ahead and turn this way. Iliac crest, PSIS, S2. I'm looking for symmetry in the height of her iliac crest. Looking at her posture, her scaps, everything. Alright, so I'm going to have you go ahead and you'll turn this way for me. And then I'm going to have you bend forward and try not to bend too much from up here, just kind of at your waist, okay? Good. Good. A little overpressure. Good. Alright. Now, don't let me move you. Good. Come back up. Any pain with that? Good. And can you put your hands on your hips for me? And now you're going to bend backwards. Good. Same thing here. A little overpressure. Alright. Don't let me move you. Good. Relax. Any pain with that? Okay, great. Can you now go down to the side? You can use your hand, put your arms by your side. Good. Here, overpressure. Okay. Don't let me move you. Good. Now, bend to the other side. Good. Overpressure. Alright, don't let me move you. Good. Relax. Alright. So now we're going to do what's called an H&I test. You don't have to do this with all patients in the scan, but for this particular patient, say she presented with back pain, we would want to assess the quadrants as well as each individual plane of motion. So what I'm going to have you do is I'm going to have you bend sideways like we just did, and then you're going to come forward. Okay, so come forward towards me. Good. Any pain with that? No. Alright, so I'm using this as a mobility test and provocation. So now we're going to the side. This also tests for instability of the lumbar spine. Good. It's a good screen for that. It doesn't necessarily tell you where the instability is, but it could indicate presence. Okay, so now we're going to bend forwards first and then come to the side. So go ahead and bend forward for me, and then come to this, bend to this side. Good. Come back to the middle, bend to the other side. Good. Back up. Okay, any pain with that? Good. And she didn't show any signs of instability, but you're looking for things to be different in one quadrant or another, lack of mobility or pain in a quadrant. If it's the same in the H and I, same quadrant, that would be an indication of like a facet problem. And then if it's different, if the results are inconsistent, that would lead you to think that there's an instability problem. Okay, so go ahead and face me now. Good. So I want you to just do a full squat. Just do a normal squat. Good. How's that? Good. Okay. Great. So that's just a good functional screen of range of motion and strength at the hip, knee, and ankle. Okay. So now I'm going to have we're going to test the plantar flexor strength, so your calf muscles. So I want you to just use your fingertips here for balance, and then you'll stand on one leg and you'll do calf raises, as many as you can. Good. All right, go ahead and switch legs again. Good, relax. So I just had her do 5, but the norm would be 25 on each side.
Next, what we're going to do for the lower extremity, we're going to go into our basic reflexes. So go ahead and uncross your legs. And down here, we've got 3, 4, 5. That's 1. 2. Okay. We're going to do our upper motor neuron. So check for clonus. And we're going to do a Babinski. Okay, so then next what we're going to do is we're going to do a slump test to look for neuromeningeal tension. So I'm going to have you round your shoulders and just get some bad posture in there. Good. Tuck your chin down to your chest for me. And we're going to straighten this leg out. And let me know if it starts to bother you at all. Okay, and go ahead and lift your head. Does this change anything? Okay, good. I'm going to relax, and then we could always adapt by playing with if it pulls cranially or caudally and like bending the knee to change that. Okay, so same thing, go ahead and bend your chin down to your chest. I'm gonna straighten this leg out. Anything? Go ahead and lift your head. Does this change anything? Okay, good. Okay. And go ahead and sit up straight and go ahead and close your eyes for me. We're gonna do some sensation testing. So just say yes if you can feel it, no if you don't, and if you can't feel it, tell me where. Perfect. Okay, and go ahead and lay on your back for me. And straighten your legs. Also, can you bring this knee to your chest? Good. Got some overpressure, okay. And don't let me move you. Good, we're gonna come here. And don't let me push you. Good, and we can already see that the hips can at least get to neutral while we're here, and they can be checked further in prone. So we're gonna bend this knee. Feeling okay? Mm-hmm. Come here to 90. Don't let me push you down. Good, don't let me pull you up. Relax. And opposite side, go ahead and bring this knee to your chest. Feel okay? Don't let me pull you. Good. Don't let me push you. Let me push you. Very nice. I'm gonna bring this down. Relax. Okay? Mm-hmm. Okay. Don't let me push you down. Good. Don't let me pull you up. Good. Relax. And come here. Go ahead and bring your feet towards your shins. Good, and don't let me pull them down. Very nice. And big toes up towards your shins. Don't let me push them down. Very nice, okay? So now we're going to a straight leg raise. So I want you to dorsiflex, internally rotate, and adduct. Let me know if it starts to bother you.
No.
Okay, we'll go as high as we can until we get that tension in there. We're going to go into our favorite test. So it is a flexion, abduction, and external rotation. We're going to come here, stabilize the contralateral ASIS, down, get a sense of that mobility, provocation, that, and cross it over the ankle. We'll do SI joint distraction. Come on to either ASIS and just apply that force. You can also cross hands over like this. Good. And lastly, we're going to just take our dorsalis pedis pulses. 2+ and posterior tib. 2+.
So go ahead and lift that leg up as high as you can for me. I'm gonna see if we can take it further. Does that feel okay?
Mm-hmm.
Good. Bring it down just a little bit for me. And don't let me move you. Good. Relax. I would do this on both sides. Go ahead, flip over that other side for me. Keep those hips pushed forward. Take your leg up as high as you can. Good. I'm gonna see if we can get further. Is that okay?
Mm-hmm.
All right, bring it down a little bit and don't let me move you. And relax. Go ahead, lay on your, actually, before we do that, we're gonna do some SI compression. So I'm just gonna palpate her iliac crest and just push down and compress them. And then flip over on the other side. Let me make sure we knock out both sides. And bring it down. Is that okay?
Mm-hmm.
All right, so go ahead and lay on your stomach for me. I'm gonna palpate for some structures. So the first one I'm gonna do, I'm gonna be palpating for the quadratus lumborum. And that runs from the iliac crest to L345. So I'm finding her iliac crest, and I'm right here. And I'm just palpating. And then I take it to the other side. And with this, I'm looking for any hypertonicity or tenderness with palpation. The other structure I'm gonna palpate is piriformis. So I'm coming right here. And I'm asking the patient, how's that feel? Is that okay?
That's fine.
Is that okay? And take it to the other side. And again, I'm still palpating for hypertonicity or tenderness with palpation. So while I have her on her stomach, we're gonna run through some PAs. I'm gonna start at T10. So to do that, I'm gonna find my mark at T12 with the 12th rib, take it up, right there. So right here, T10, T11, T12, L1, L2, L3, L4,